Good day and welcome Machinist Union members and our allies in the labor movement. This is your weekly 141 report, and I'm your host, Dave Lehigh, the communications representative for District Lodge 141. The report topic this week is about the IAM's very important Employee Assistance Program, commonly known as EAP. Today, we have back on the program 141 Director of Employee Assistance, Bryan Hutchinson. Join us as we discuss this and other information as our 141 report starts now. Hello, Brother Bryan. Welcome back to the 141 report.
Good morning, Dave. It's great to be here with you again. It's been a while.
It's always great to have you on. You know, there's been a lot of things going on lately, and I thought it'd be a good idea to have you back on the program. So, Bryan, you were on this program a little over a year ago since your last report, and some of our viewers might not know who you are and your background. So can you please brief everyone on what you do?
Absolutely. So, Director of the International Association of Machinists Employee Assistance Program for District 141, which covers United American and Hawaiian and all the members, so customer service, ramp, stores, reservations. We've been around for the EAP with the IM has been around since the 70s. Started out as an alcohol and drug program, and then as society changed, we changed with that, and people started using like cocaine in the 80s, and then a lot of other drugs came up in the 90s, and mental health issues started to be a problem for the members too. So as the membership needs shifted, we shifted with them to today, quite frankly, where mental health issues are much more of our where we're focused right now because of COVID and the incredible amount of anxiety and consequently, when that's not treated, depression that the members feel. We still cover the drug and alcohol part of it and mental health, and we have regional representatives on United in all of the hubs. On American, we're working to get there, and we're here to service the membership and their families in a way that any mental health or substance abuse issue that they may be experiencing, we will, in a very confidential manner, talk with them, figure out what's going on, and find an appropriate resource for them to be able to handle whatever problem they may be experiencing. Okay.
So, brother, with all the crazy stuff that's been going on in the world right now, with the continuing pandemic, inflation is starting to come into be a factor, financial instability, and now a war in Europe. Some members might be having trouble dealing and coping with stress and other mental health issues and feeling like they have nowhere they can turn. So can you tell the viewers why the Machinist Employee Assistance Program is so vital for their members and family members that they have today?
There are a lot of resources to address what you were just talking about, Dave. The stress and the anxiety. One of the big issues with COVID and the last 2 years especially has been the isolation that we've all had to experience. That drives, like I said, anxiety, that drives depression. That just makes a lot of the mental health issues that you may have been experiencing or been able to kind of keep at bay, that makes that much worse because you don't have contact with others. For example, with drug and alcohol programs, people in recovery, when you isolate, that's well known to those communities that causes problems and it causes you to relapse. We've seen some things in that area that we haven't seen in a long time, like people that have long-term recovery, 10 years or more, or have started to relapse. It's easy to get alcohol delivered to your house, just like with your groceries and everything else. So with the mental health part of it, it's, people have been on top of each other because they've all had to be at home. They're not used to that. They don't have the outlet outside of the house, outside of each other. And that has caused some problems too. Families have become, a little bit more dysfunctional than they might have been if, had people had outside interests that they could participate in. So it's been a conundrum. And then, as you just said, it's one thing after another. We had the Delta variant, and now we had Omicron, and that, was so highly infectious that people were so afraid. And now it seems like everybody's had it. Everybody's waiting for, what happens next. And now we have inflation because of the supply chain issues that are coming up. And now with Russia invading Ukraine, that just puts everybody on edge, and oil going skyrocketing. The price this morning was, $100 a barrel, which we haven't seen since 2014. That just causes this kind of this anxiety to build, and nobody has a way of dealing with it. So we got a lot going on, and that's why we're here, to find you some resources to be able to deal with whatever you're experiencing. There are a plethora of resources online, a lot of apps, and we'll talk about that in a little bit. There's a lot of things that you can access depending on what kind of insurance you have, and that's what we do. We help you figure out what insurance do you have, what does it cover, how do you access the services that you need to be able to deal with whatever you're experiencing.
So let me ask you, how does someone know that treatment is a good option for them? I mean, they probably are sitting there going, do I really need to go for treatment, or do I need to see somebody about, what's going on in my life?
Yeah, good question. With drug or alcohol, just a real simple rule of thumb is, if somebody else is telling you got a problem, it's probably time to address, what's going on. Usually you have a spouse or significant other, or, sometimes if you're an older adult, your kids will say, hey, dad or mom, we think you may be drinking a little too much, or we're concerned about your prescription drugs, which, we haven't even talked about the opiate crisis, but it's still there. The doctors are still prescribing opiates for pain management. It's changing a little bit, but that's easy to get, an Oxycontin or oxycodone or hydrocodone prescription, and find that, you like those a lot, and you start taking them a little bit more than you're prescribed. And next thing you know, you have a problem. And just because a doctor prescribes something to you doesn't mean it's a safe drug. If you take it as prescribed, you're going to be okay. However, a lot of people get outside of that, what the doctor says to use it, unfortunately. So a drug is a drug is a drug. How you know you need treatment is when you're outside of the prescribed dosage, when you're drinking more than you normally would, or you say have a glass of wine every night, and pre-COVID you weren't doing that. Now you can't imagine not having it. It's probably time to sit down and talk to one of us and just say, here's where I'm at. This is how much I'm drinking. Do I need to worry? Generally speaking, there are some pretty strict guidelines that the government over the years has put out that are good. And in general, let's see if I can remember these. It's a drink a night for women, and 2 for men, but no more than 5 a week for women, and no more than 7 a week for men. So a drink would be a beer, an 8-ounce beer, a glass of wine, so 4 ounces of wine, or 1 ounce of spirits, so hard liquor, in that area. If you're drinking more than that, we probably need to sit down and talk with you and see if it's a problem or not. And once we determine, where we're at, you decide. The conversation is confidential, as I said earlier. We'll sit down and talk with you and say, here's the guidelines, and then you decide, is it a problem for me or not? And if you decide it is, we'll go through all the different kinds of treatment, and we'll go from there.
Okay, so let's talk about treatment options. What kind of treatments are available to our members?
Yeah, good question again. So there's really 3 different levels of treatment. The first one is just going to an AA meeting. There's lots of different 12-step meetings. That's all free. There's no cost to that. We generally recommend you go to several different AA meetings, mainly because all of them are different. Some of them are, you'll go and it's a bunch of old guys that have been in recovery 30 years, and they're all working that program. Some of them are, young folks in their 20s and new to sobriety. Some of them are people in their mid 30s or 40s. So we recommend you go to a couple different groups just to kind of get an idea of, one, what happens there, and then two, what feels comfortable to you. Because eventually, if you're going to get into AA, we're going to ask you to have a sponsor. They do 12 steps. It's a structured process that you go through to really work through, what it was you're doing when you were drinking, if you're coping with problems or just numbing yourself out. AA kind of teaches you how to cope with life without alcohol or without drugs. And that's what the 12 steps are all about. So that's the first kind of really non-invasive voluntary part of it. The next one is called IOP, intensive outpatient. And that primarily involves drug and alcohol education. So they will talk about, this is what drugs and alcohol do to you. This is how it affects your body. This is how it affects your brain. This is, why people drink. And they will also teach you coping skills without alcohol or without drugs, how to deal with life, which is how most of us deal with life in general. So that's intensive outpatient. You go to a treatment center or a storefront where they have these meetings, and that's usually anywhere from 3 to 5 days a week, 2 to 4 hours a day, and that lasts up to, generally speaking, 6 to 8 weeks, so 2 months. So that's intensive outpatient, and you're home every night. You're in your own bed. And then the last one is inpatient, which is you go into a facility specifically for alcohol and drug treatment, and you're there all day, overnight, for up to 30 days generally, if the insurance will cover it. And you're just in there doing what you do in intensive outpatient, but in a more intensive way. You're learning about what drug and alcohol does to you and your mind and body, how to, you're learning different coping skills to deal with life. And you're really kind of shifting how your lifestyle, because you're getting rid of the ability to, go out and have a drink and cope with problems that way, or not cope with problems that way, as the case may be. Generally speaking, when you have that going on, you have a group of friends that are drinking and drugging with you. And part of what happens is we work hard to get you into a little healthier community, like AA, people that aren't drinking and drugging, but are really learning how to deal with life in a more effective way. It's worked for, hundreds and hundreds of millions of people over the years. A lot of people that are out there not drinking and drugging. One of the things that always comes up that's always an interesting side effect, Dave, is when we start talking to people about quitting drinking, inevitably it gets into, as you were talking earlier about finances. When we start looking at how much they're spending at a liquor store over the course of a month, we find out they will be surprised to find out they're sometimes spending $500 to $700 a month on alcohol over the course of a month. Yeah. So finances just kind of help, just because you're not going to the liquor store spending all the money on alcohol.
And I want to interrupt you 1 second. It's not just alcohol. I don't really want to get too sidetracked, but a big problem that we're starting to see is the states that are legalizing marijuana.
Absolutely.
Now people are going out and buying recreational drugs, which they shouldn't be doing, especially in the airline industry.
Right.
Because there's zero tolerance for that.
Right.
So,
yeah, but thank you for bringing that up, because that is an important message. You cannot, the laws that are written for recreational and for medical marijuana allow for companies to say they can have a drug-free workplace. Generally speaking, any company that has a contract with the government has to have what's called a drug-free workplace. And there's, as you just said, no tolerance for THC, for amphetamines, for benzodiazepines, which are, Valium, downers, Xanax, those kinds of things, alcohol, and oddly enough, PCP, which I'm not sure is why it's in there, because it's pretty rare. But the laws that are written allowing recreational or medical marijuana, allow companies to say, you can't have this in your system. And THC, while many people think it's harmless, it does reside in your fat and in your body, and it can stay in your body 30 to 60 days. Sometimes we're finding people with 90 days later after their last smoking a joint or eating an edible, whatever, it's still there 90 days later. The other thing that's important to know is people that are using CBD oil, they can't get THC out of the CBD oil. They can get a really low concentrate, but CBD, easy for me to say, that's all unregulated. So you do not know when you're using CBD how much THC is in that oil or in that lotion, whatever. And flight attendants in particular are finding that as I said, THC resides in your fat. Some of them are starting to test positive and they've never smoked or eaten edibles. And it's because of the CBD oil that they're using that they can't get all the THC out of. So that's been a problem lately too.
Okay. I didn't want to get too sidetracked on it, but I just want to make sure I brought that up. Let me ask you, so how will the IM EAP be involved when a member goes into treatment?
Yeah, so we will be there from the front end of it. We'll walk you through, what's about to happen to you when you decide treatment's what you need to get through a rough spot. The regionals on the case with United, and on American, it's Chris Davis. We will talk with you. We will help you decide on which treatment center is best for you. And that's a lot of what our job is. And we will get you hooked up with their folks, their staff that will do the initial assessment, and that'll determine what your treatment's going to be about for the next 30 days. Hopefully you get insurance to pay for that. We'll stay with you. We'll make sure that you get there, that, once you're there, you're settled in. We'll let them work their magic while they're there, but we'll keep track of what's going on with you and what issues are of concern to the extent you want us to know. Again, that's all confidential. And then as they're getting towards the end of treatment, that last week or so, we will get involved in the discharge plan. So there's always a plan of, all right, you're about to leave treatment. How do you go back home, and how do you apply what you've learned here to your home situation, and how do you maintain your sobriety or your drug-free state once you get home? And we'll help you with that. We'll help you with the transition back to work. For example, one of the things that we always sit down and talk with people about is, what are you going to tell people when you get back to work? Where have you been for the last 30 days? You don't have to tell people, hey, I've been at a drug treatment center. And we'll find what's comfortable for you so you can reintegrate back into the workplace. One of the things I like to do, if we can, is set you up with somebody at work that's in recovery, so that you have somebody there at work if something happens and triggers you, and you have somebody there that can kind of walk through the process with you. And then we ask that you, in the case of alcohol in particular, that you go to 90 meetings in 90 days. And that's just kind of continuing your education. And part of it is getting back with the old crowd, quite frankly, of, going down to the bar, because that's where my friends are. We're going to ask you to make new friends in AA that are sober and leading a healthier lifestyle. And we'll stay with you through that, and particularly through that first year, because we know if you can maintain your sobriety or your drug-free state through that first year, then you're much more likely to maintain sobriety through the rest of your life. So we'll stay with you through the whole process. We'll hold your hand. We'll do whatever needs to be done. That's what we do. That's what we're here for.
Great, brother. That's some really useful information. Listen, time's running short on us. So anything you want to add before we close out this week's report? I mean, I want to ask you is, a member wants to get help. Who do they talk to? Who do they call?
Yeah, you can go onto the 141.org website, im141.org, and click on EAP, and that'll pull up all the different regionals. As I said, on United, we have regional representatives on the hubs. Those are all trained in EAP. They all know what they're doing when it comes down to anything that comes up, any kind of crisis. So get on the website. And American, like I said, Chris Davis is there. And Hawaiian, just feel free to give me a call right now. And we'll deal with whatever comes up and find a resource and get you back on track.
Well, thanks, brother. Bryan, I appreciate the work that you and your team continues to do for the members of District 141. And I appreciate you taking the time out of your busy schedule to talk to our viewers and for your report today. So thanks again.
Absolutely, Dave. Thanks for having me on. I got a great team. Everybody on the team is really good at what they do. And like I said, they're confidential, they're trustworthy. I hope people will reach out to them if they're struggling with any kind of issue.
Well, this wraps up this week's 141 report. Everyone stay safe and healthy. Have a good weekend. Bye for now.
Thanks, Dave.